Governments across Europe are struggling to stem the huge increase in coronavirus cases due to the new Omicron variant. The Netherlands is the first country in Europe to reinstate a lockdown which will last until at least mid-January. All non-essential shops, as well as restaurants, bars, cinemas and theatres are closed starting today, Sunday. Meanwhile, the situation in the British capital, London, is also causing concern. The city's mayor has declared a major incident. Health authorities there have reported their highest ever single-day tally of coronavirus cases at more than 26,000.
A city in crisis mode, London is being hit hard by the Omicron variant of the coronavirus. It has already overtaken Delta as the dominant strain here, driving up infections and forcing the mayor of London to react.
Hospital admissions are going up, but also staff absences are going up by a massive level. So I've taken the decision, in consultation with our partners, to declare a major incident today.
The measure was last taken in January and allows local government to work more closely with emergency services. It's not just the capital that is in crisis. For several days now, the UK has witnessed record case numbers. In response, the government has stepped up its vaccination campaign. Almost 3,000 locations across England were turned into makeshift vaccination centres on Saturday. The UK's Omicron surge has prompted Germany to impose tougher rules on travel from a number of countries, including the UK. But restricting international travel will only slow the spread at best. Dutch Prime Minister Mark Rutte on Saturday announced a lockdown that will limit gathering over Christmas and close shops, restaurants and cultural venues.
We need to intervene now to prevent a much worse outcome. The lockdown is a precaution. That's the complicated story we have to tell.
Shoppers rushed for some last-minute purchases before the measures came into effect. Lockdown or none, the WHO expects Omicron to become dominant in the countries where it has taken hold. Scientists warn the surge in cases could further burden overstretched health systems and lead to staff shortages across many sectors.
Here's a look at some other developments in this pandemic. Germany has put the United Kingdom on its list of high-risk COVID countries, meaning tight travel restrictions starting Monday. Arrivals from Britain will need to quarantine for 2 weeks, whether they are vaccinated or not. The World Health Organization says the Omicron variant of the coronavirus is spreading faster than the previously discovered Delta variant. The WHO said, however, Omicron's severity remains unclear. The variant has now been discovered in 89 countries worldwide. In the US, the coronavirus epidemic is getting worse as the Delta and Omicron variants continue to spread. The overall number of confirmed COVID-19 cases surpassed 50.7 million on Saturday, with some experts fearing that the country's already overburdened healthcare system could collapse. For more, I am now joined by our correspondent, Christine Mundua in Amsterdam. Hello, Christine. The Netherlands lockdown is already in effect. What's the mood there in Amsterdam?
Hi, Eddie. So there are a lot of people out and about in the streets of Amsterdam today. A lot of them are tourists who are now scrambling for what to do because a lot of their plans have been affected by this new lockdown that's come into place. I visited what was supposed to be a Christmas market today that's basically been taken down within hours, really, since the Prime Minister spoke last night. Very angry people, disappointed. This was supposed to be a time for them to make a lot of money, essentially. But, you know, because of this announcement, everything has to close. Little kids disappointed. They can't even do things like ice skating in the outdoors. So there is a lot of disappointment here and people just making do with what they can outdoors, as you can see happening around me and behind me.
Disappointments are, I guess, quite understandable. But what made this lockdown necessary, Christine?
Eddie, it is Omicron, in short. I was in the Netherlands not very long ago, about 3 weeks ago, and already then it was clear that infections were rising. In fact, hospitals in the southern province of Limburg were already reporting that their COVID wards were at high capacity, and that it did necessitate some kind of a lockdown to slow the spread of infections. Of course, the idea back then was that if that lockdown came into effect, what was a light lockdown back then, that it would free up at least the space for Christmas celebrations and for the Christmas holiday period to go as planned. But Omicron has obviously thrown in a curveball, and now we see that infections continue to rise. 3 weeks ago, Omicron was detected here, and it's expected that between Christmas and New Year, it's going to be the dominant variant here. So we are looking at a government that is looking to do as much as possible to sort of slow the spread of infections, to allow the booster rollout. There is an 85% vaccination rate here, but less than 10% of adults have received a booster shot. So this is really about allowing the system to catch up in that sense, as well as to allow hospitals to be able to make way for what is expected to be an onslaught as the infections here continue to rise.
DW correspondent Christine Mundwa, thank you. For more, let's bring in health analyst John Campbell. He joins us from Carlisle in the UK. Hello, John. Different restrictions are coming back. The Netherlands has just gone back into lockdown. Other countries like Germany are tightening travel restrictions for people coming from high-risk countries like the UK. But what is more effective?
Well, these lockdowns, all they're going to do is delay the progress of this Omicron variant, because it's in every country in Europe already. So even though the Omicron levels in Germany at the moment are quite low, it is there, probably 2-3% of cases. So all this is going to do is delay things by a small amount of time. Basically, everyone in Europe needs to be ready to be infected or exposed at least to Omicron in the next few weeks. It's dividing so quickly, spreading so fast. The R value in the UK is probably between 3 and 5 at the moment, so it's coming everywhere. So what we need to do, I feel, is use the time to be as prepared as possible. Now, governments are launching booster campaigns, vaccination campaigns, and that's correct. But I also need to think, we need to think about ourselves as well. So what are our zinc levels? What are our vitamin D levels? Because we know vitamin D is important for immunity, and we get it from the sunshine. And this time of year in Northern Europe, unfortunately, we don't get any sunshine. And getting plenty of sleep, getting some exercise, all these things are going to be important when we are exposed to the virus. And then we can be hopeful that the vast majority of people will get no symptoms at all, or a very minimal set of symptoms.
That's interesting practical advice you're giving there. I mean, you mentioned it earlier, some virologists are even calling for a herd immunity approach. Could that be the way to go, you think?
There's some science that's starting to demonstrate this. So there's some research out of Hong Kong that shows that the Omicron virus replicates very much in the upper respiratory tract rather than in the lungs. And this means there's going to be an awful lot of the virus around, and people are going to be exposed. Now, every time someone's exposed to the virus, they will generate an immune response that will improve their immunity. So as millions of people, tens of millions of people in the next few weeks in Europe are going to be exposed to the virus, then that inevitably means that community or herd immunity is going to be increased. The problem is that there's going to be so many cases in such a short period of time that even if a tiny fraction of people do get ill, that could be a lot of people getting ill all at the same time. So that is the risk. But the good outcome of this is by about February, probably everyone in Europe will be exposed and their immunity will be increased. And there is real hope that this could cause very widespread herd immunity this time.
OK. A quick one on this. Will we need new jabs, say, every couple of months to adjust to new corona variants?
Well, let's hope not, because that's not really a practical way ahead. But the German government has just ordered 80 million doses of Omicron-specific vaccine in case it's needed. But I'm really hopeful that this sort of herd immunity that's developing will take over and make this particular Omicron variant like the other 4 common cold coronaviruses that we already have, because we have coronavirus infections all the time. It's just that this is a new type of coronavirus. So we're hoping that this will blend back down into the sort of endemic viral ecosystem that I'm afraid we all live in.
OK, let's keep hope alive. Health analyst John Campbell, thank you.
Thank you, Eddie.
DW correspondent Charlotte Chelson-Pill is in London. Charlotte, more countries now bringing in travel restrictions for people travelling from the UK, such as here in Germany, because of the alarming situation there. And it's also moving at an alarming pace. Take us through the current situation there at the moment.
Rebecca, that's right. Germany, the latest country to add the UK to its list of high-risk areas. As of tonight, anyone arriving in Germany from the UK will have to quarantine for 2 weeks, irrespective of vaccine status. They're looking, as you say, at this rise of Omicron cases in the UK at the moment. We know that Omicron is now the dominant variant in both England and Scotland. London particularly badly hit, as you heard in that report there. A major incident has been declared here. Essentially, that means that officials, the Mayor of London, can't guarantee the same level of service from emergency services from hospitals as the public may like. He's, the Mayor of London, pointing particularly to staff absences as a result of the spread of Omicron. Now, a massive record 10,000 cases were reported in the UK yesterday of this new variant. The Mayor of London saying that hospitalisations are already rising. They are up 30% this week alone. So a lot of concern here about what we were warned would be this tidal wave of cases.
Is that concern translating into the government doing anything to tackle the spike of infections? We're seeing stricter measures come in and elsewhere. What's happening in the UK?
Well, the different nations in the UK have different rules. To take England as an example, hospitality is still open, pubs and restaurants, shops are still open as well. So compared to a number of places, there isn't as many restrictions as, say, the Netherlands, for example. But new rules were introduced. Working from home is advised. Mask wearing is mandatory once again. The government wanting to focus, though, on its booster campaign. It's, as you heard in that report there, massively ramped up its booster campaign, and a huge 50% of adults in the UK now have had their booster jab, and that is expected to give the population a good level of immunity against the Omicron variant. But there are, as you might expect, officials who are calling for far tighter restrictions, some saying that if the restrictions don't change, you could see thousands of hospitalizations a day, a good deal of concern. Reports as well that there might be a lockdown being considered after Christmas.
Well, as you say, the government seems very divided on the restrictions, and many of Boris Johnson's own ministers have been revolting against him, one even resigning over the issue. Why is there so much conjecture in the government?
Yeah, yesterday afternoon, the Brexit minister appeared to cite COVID, the latest COVID restrictions, as one of several reasons for his resignation, saying he didn't like the direction the government was going at the moment. And this week, Prime Minister Boris Johnson saw the biggest rebellion of his premiership so far over one of those series of new rules that I mentioned that were introduced this week, the particular issue being the requirement for people to show either a negative test or vaccine status to get into clubs or large venues. There's a lot of upset about that. These lawmakers who are rebelling really do cite civil liberties, freedoms. Many say that the UK was promised irreversible freedoms over the summer when Freedom Day was announced. They are very loath to allow more restrictions coming in future.
All right, Charlotte, thank you. DW's Charlotte Chelson-Pill speaking to us from London. While several governments in Europe are drastically tightening restrictions, they're also seeing pushback. This weekend saw protests against restrictions in a number of capitals, some resulting in clashes between protesters and police.
Rage bubbling over in Germany. More than 11,000 protesters flooded the streets of Hamburg as opponents of tighter COVID measures came out across the country. Fists also flying in London. These protesters say they've had enough. Around 5,000 of them marched against the latest round of COVID restrictions in the UK. Here, the more transmissible Omicron variant has forced the government to tighten restrictions. But scientists are warning that even more must be done, and fast, if the country wants to stop hospital admissions from soaring.
All of the meetings that we've attended insofar as the network is concerned, where modelling is taking place, the message is clear that this looks like it's the calm before the storm.
It's a problem across Europe. Surging cases of Omicron and increased frustration at restrictions to combat it. In Austria, several people protesting a vaccine mandate were arrested after demonstrations got increasingly out of control. Thousands of protesters in France also took to the streets to express their anger over a vaccine pass being discussed by the government. If the bill passes, it will bar the unvaccinated from entering public establishments like bars and cafes.
A vaccine pass is a form of dictatorship, not a public health issue, but a political one. We have to realise we're in a system that is working more and more to reduce our freedom.
As governments across Europe get ready for an onslaught of Omicron, they may also have to fight against the frustration and weariness that new restrictions can bring.